clinicians and, a neuroscientist and 2 clinicians with either active duty or past civilian experience in the US military. And in honor of Veterans Day, and to say thank you for all of their service, we thought it made sense to focus in a little bit on military health and where opportunities might lie ahead. So I'd like to welcome our 3 panelists to the stage, Dr. Andrew Holdaway, Dr. Roger Boodoo, and Dr. Sean MANION. Please come on up. And can everybody give me a round of applause? Thank you very much. So we have a 45-minute segment today, just so that you all know that you don't need to be as concise as you may typically be. We have time to really unpack and explore some of these ideas and topics. So let's start with introductions. I'd like to begin with you, Dr. Holdaway. Maybe take 2 to 3 minutes and describe your role and your interest in blockchain.
So my name is Andrew Holdaway. I'm a family medicine physician and recently went through a clinical informatics fellowship at Madigan Army Medical Center in partnership with the University of Washington up in the Tacoma, Seattle area. And many of you are probably aware informatics is the intersection of healthcare delivery and health IT and other elements like change management that we heard in our previous discussion about how do we get people actually adopt new behavior. And so as a primary care physician, very interested in the promise of blockchain in terms of creating a transparent, trustworthy record, especially in the patient record space, so people can start controlling their data, using it how they would like it to be used. I think we don't know what the future holds. It's probably I saw on the back of the magazine a blockchain bingo, so I'm trying to hit as many of those as I can, but on the inside cover. But anyway, yeah. All that aside, I think there's a lot of innovation. It's not a panacea. I don't expect it to solve all of our problems in healthcare, but moving towards more collaborative models, moving towards, the traditional model of healthcare is very paternalistic. The patient comes to me, I tell them what to do, they come back in a month and we decide if I was right. And I think with moving into the patient space, giving them more control allows us to have a much more collaborative and hopefully more meaningful relationship as a patient and a physician. I think that this will ultimately enhance that relationship and drive better outcomes. So, thank you.
Thank you, Dr. Holdaway. Dr. Boodoo.
My name is Roger Boodoo, and just like Andy, I did a clinical informatics fellowship. I did at University of Illinois in the civilian sector, so I look so different on the page of the screen there. But I'm also a radiologist by training. But having been a fellow on the outside, it gave me a lot of leeway in terms of nobody supervising me. I had a lot of free time to really dive deep down into the blockchain. Just sort of happened 2016 when the ONC had their white paper contest for blockchain. That's where I kind of dived deep down into it. And my interest, I'm a radiologist. I realized real quickly that patients get on my nerves. So, I stayed away from patients. But my interest comes actually, as Aman said earlier, the incentive model of patients. It's hard to get, the reason why I don't like patients is because you try to get them to do something. They don't stop smoking, not all patients obviously, but it's very hard to change behavior. So I'm really interested in the incentive model with tokenomics. How can we incentivize better behavior? And my other interest obviously is medical imaging. We have the same problem in medical imaging as well. It's hard to incentivize. Everyone hears that artificial intelligence are going to replace radiologists, but the incentive is not there to replace us. And we have all this data that's stored in silos and it's not structured properly. So I'm really interested in trying to solve that problem of structuring the data. But radiologists are too busy and they don't have the time to structure data for machine learning. So it's not an apple. So it's kind of like the chicken or egg problem. We can't get people to structure data in order to replace us. So that's where my interest lies in medical imaging and blockchain, trying to find blockchain use cases in DoD as well.
Thank Thank you, Dr. Boodoo. Dr. Mannion.
Yes, and I have a long stare here, so I think you can tell I never served in the military in uniform. But I was honored to support the military health system as a graduate student in uniformed services and then a contractor and later a federal civilian for almost 18 years. And while I did that, I got trained as a neuroscientist and later served as a research administrator. So I understood sort of the evidence training that goes into medicine in a lot of different angles, in a lot of different ways. And similar to Roger, in 2016 with ONC's, Health and Human Services ONC's white paper contest, I got a really deep introduction to what this technology could do if applied right across a lot of different areas. And it to me, especially with the research administrator's lens on, showed me a lot of applications to different pain points I had seen with data sharing, and even with simple administrative applications. But I also felt there was an even deeper application with regard to research data and making it a more viable source and a less noisy source for evidence-based medicine. And I left the federal civilian service in 2017, and I've started up a small company called Science Distributed. But I also have an eye towards the value that this could bring both to the DoD and the VA with respect to readiness, with respect to quality of life and outcomes, as well as health and human services and more broadly the outcomes that it could improve. And so I have a keen interest in making sure I can help in any way, whether it's informationally or just putting the right people together in moving that aspect of the mission forward, because I think the DoD and VA especially have a very special type of population where they can on an enterprise level trial a lot more than we're going to see happen in the civilian population. And I think that they're going to have lessons learned from that can benefit not just the country but the world. So I think that's something that will help them realize the value of this and sort of lead from the front, and hopefully we can get enough interest and energy and knowledge to, a lot of DC constituents, but I think the power of the DoD and the VA comes from the military treatment facilities and VA medical centers that are out there across the country where a lot of the innovation happens. So I still do want to be successful in business, but I'm happy to help with the mission whenever I can.